Hello and welcome to my YouTube videos. Today I'd like to talk to you about suicide in children and teenagers. My name is Tracey Maxfield. I'm a nurse, author, peer specialist, and stop bullying and mental health advocate and educator. My mission is to help engage, educate, and empower our children and teenagers and help them to learn as much as they can about bullying, mental illness, and suicide that will enable them to develop not only good coping strategies to help themselves, but also enable them to be a great support to others. So in September, the week September 8th to the 14th is officially designated as Suicide Prevention Awareness Week. And on Tuesday, September 10th, it is actually World Suicide Prevention Day. Now, I think this is a great idea, a week dedicated to talking about suicide. What is it? Suicide prevention strategies. However, what I think is really important and what we need to remember is that the topic of suicide should take place 365 days a year, 366 on a leap year, just as the topic of mental illness and bullying should take place every single day and should not be designated solely for weeks, days, or months of the year where there is awareness. Now, here are some really surprising suicide facts that I think many of you will be a little stunned by. So every 40 seconds in the world, someone somewhere dies by suicide. I want you to think about that again. Every 40 seconds in the world, someone somewhere dies by suicide. And suicide has no favorites. Any gender, any age, any race, religion, culture, ethnicity, occupation, economic standing, it does not matter. Here in the USA, on average, 16 teenagers die by suicide every single day. 3,140 students in grades 9 through 12 attempt suicide daily, and this is just in the States, and these are just grades 9 through 12. They estimate that the grades lower than 9, maybe another 800 to 1,000 students try to die by suicide every single day. Those numbers are staggering. When our kids should be out having fun, developing friendships, going on dates, sports, buying a new car, fixing up a car, just doing things that kids and teenagers do. Instead, they feel so helpless and so hopeless and that life is not worth living that they chose to end their life by suicide instead. This is sad. This is horrendous, in fact, and this just cannot happen. Now, suicide is the act of ending one's life. It is usually planned and it is often intentional. And what they say is there's always 3 components to a suicide plan. We have the ideation, we have the intent, and then we have the plan. Now, suicide ideation is actually very common, especially in those that have an emotion disorder, such as bipolar disorder or depression. It is also very common in those that are actually living with schizophrenia. And suicide ideation is thinking about suicide, wanting to die by suicide, considering that it's the only option, imagining what it would be like if you actually formulated a plan and died by suicide. And so it is that thought, those intrusive dark thoughts that are in your mind. It could be every minute, every hour, every day, a couple of days a week, a couple of times in a month, but that is suicide ideation. Suicide ideation is you have depression, you're on medications, you're going for counseling, you seem stable, and then you flunk an exam and your girlfriend breaks up with you. And the first thing you think is, I'm hopeless, no one loves me, no one will ever love me, and I think it's just better to die by suicide. Suicide ideation. Suicide ideation is serious. When someone talks about wanting to die by suicide, if they discuss their plan, their method, then that's showing intent, and you have to get help for them. You have to listen to them, you have to validate their concerns, and you must get help for them. Because all too many times I've heard people say, oh, he talked about it all the time, but I never thought he'd follow through. I'm sorry, but guess what? They're following through now. Suicide is at an all-time high. Did you know a couple of years ago, suicide amongst girls aged 13 to 14 reached an all-time high? And in fact, suicide is now the second leading cause of death amongst children ages 5 to 24 years old. Think about that. Children as young as 5 are now dying by suicide. So when you think about a child, a teenager, and suicide, it's hard to fathom. Why is it increased? There's no one single answer. Definitely, we have societal pressures. We have economic hardships and burden, homelessness, poverty. We have the untoward pressures put on and the expectations in school and schoolwork, especially, to excel. Then we have to look at those that are in increased likelihood of developing a mental disorder or mental illness. We have to look at our environment, our external environment, and look at our ACEs, our adverse childhood experiences, and we actually discussed those in earlier blogs, blog 1 and 2. And we also have to look at family history. Someone whose parent has died by suicide or has a mental disorder is more at risk, an increased likelihood of actually following through with the suicide plan. We also have social media. We have bullying. All of these are now contributory factors to why there is an increase in suicide. Plus, we have access to firearms and drugs. It's estimated that approximately 80% of all those teenagers who died by suicide were under the influence of drugs or alcohol. And what that does is it lets down your guard. It becomes as you come out of the initial high created by the drugs and alcohol, you then have a low, but it also gives you that feeling of lack of inhibitions and power of control, and so you don't understand the implications, the consequences of what you're doing. You're now engaging in risky behavior, which the ultimate conclusion could be death. I think what's important to remember is suicide is not a mental disorder or a mental illness. It is a result of an inability to deal with the mental illness, whether or not no one listens and it's not recognized and being treated, or it's being treated but the treatment plan is not being followed through, or the treatment is started but you're having bad side effects and then you're not following up. Suicide is not a response to normal everyday stresses. You know, when you fail an exam, when you crash your car, you don't normally go, well, I'm just going to go home and kill myself now. And so suicide is an abnormal stressor. It's an abnormal reaction. And I think another factor is that there's a lot of copycat. And so with suicide, if you find in a school a couple of kids die by suicide, it's not unusual for more kids to follow suit. It creates, it's not the right thing to say popularity or anything like that, but they copy. And in fact, many of you may have remembered the outcry from the book and then the movie on Netflix, 13 Reasons Why, and it was about suicide. There was an increase, a 19% increase, not only in suicides, but also on the internet search for ways to die by suicide. So as you can see, it is a factor that affects all of us. It does. I myself have been suicidal. I have formulated a plan. I have gone to act on it, and there by the grace of God, here am I didn't follow through by weird circumstances. I think it's imperative that we try and understand the suicide warning signs. Lots of people say that it came out of the blue. What research is now telling us is it rarely comes out of the blue. There are always signs, but sometimes they are so covert and subtle, overt, that you don't notice them. So the more obvious is talking about a suicide plan, writing a plan, setting aside a specific date, stockpiling ammunition, talking about going shooting at a school, stockpiling drugs and alcohol. Another warning sign is a change in behavior. They may become moody, more irritable. They're more tired, they're more withdrawn. They socially isolate themselves. You'll find that their grades are dropping in school. They're no longer following through on activities. Their friends say that they're different. They're not the same person. And I think this is key. He or she is different. I can't put my finger on it, but something's not right. If you're thinking that, if you're seeing that, you need to follow through. Those that are at risk are already those that have been diagnosed with a mental illness or a disorder and maybe having challenges with counselling or refusing to go for counselling, or have additional stresses in their life, kids that are being bullied. So I think those are all signs that you need to look for. Other signs are that out of the blue, from being withdrawn and sullen and quiet, he's suddenly the life and soul of the party. Let's go out, let's have a party, going around telling everyone, I love you, everyone, this is awesome. That's the precursor to going home to die by suicide. It's the finale. Other things, preoccupation with death, watching death things on movie, researching on the internet, reading books, listening to really sad, heavy, mournful music, or with suicide lyrics, giving away possessions, making a will, making funeral arrangements, or deciding what songs are going to be played, during the service. Other warning signs: engaging in promiscuous behavior or risky behaviors, increased alcohol or drug abuse, driving recklessly. It's called having a death wish. Running away from home, neglecting personal appearance, all of those things. Yes, they also point that they could have a mental disorder if it's not diagnosed, such as depression, but it also is leading hand in hand to potential, I'm now going to choose to end my life by suicide. I think what's the most important thing to remember is, and this is what I've heard, and I can personally attest to it, suicide is not a way out because of cowardice or failure to cope, or you're just not strong enough. Suicide is the only way out because you cannot bear to continue to live with the pain and the torment and the turmoil and the inner just horrific feelings of worthlessness and helplessness and sadness and sorrow, and that no one loves you and that the world is better off without you. You see no way out. You see no light at the end of the tunnel. You do not see how it could possibly be better tomorrow, the next day after, and the next day after. And that is why it's just that final cry of, I can't keep doing this anymore. I am so physically and mentally exhausted. And that's how I felt when I started my plans. I think what is most important is, as soon as you're having cues that something is not right, it is better to be a more intrusive, nosy parent, friend, girlfriend, teacher, counselor, grandparent, than to just ignore it and think it's a stage, it's hormones, they're growing out of it. It is better to show care and compassion and love. These kids want love. They want someone to validate their concerns. They want someone to believe in them. They want someone to listen and show them love, that they are important, that their lives are important, that they have worth, and that your lives would literally fall apart without them. If your child or teenager is showing signs, please, please, please get help. Go to the doctor. Likely from then there'll be a mental health counsellor, there'll be an assessment, there may be a psychologist or a psychiatrist, and follow the treatment plan and continue with regular follow-ups. Secondly, and a point I forgot to mention, look for signs of cutting or self-harm. That usually escalates as it gets closer to the date. Also, I think if it's something that you feel no control of and you're really scared that they're going to do something soon or imminently, then you know what? Take them to the hospital, take them to the nearest emergency department and get them assessed and admitted. A psych consultation is going to be much easier than 3 days later something happens and you then have to live with that turmoil and guilt. So it's get help, get help, get help, get help, get help. If you have a teenager or if you're a kid listening to this, please talk to a friend, talk to a parent, reach out for the suicide hotline in your area. Most of them you can call or you can text, but every single area, and this is not a blurb for my website, but if you go on my website, www.traceymaxfield.com, there is a list of every single suicide hotline number in every country in the world, plus a huge lot of resources solely for Canada and the United States. If you come across someone that has attempted suicide, the first thing you do is make sure they're safe. If they're still holding the gun, remove the gun. If they still have pills and a bottle of wine in their hand, remove them. Dial 911. You have to get help immediately, and then you administer first aid. So it may be if they've slit their wrists, compression, put towels, bandages on them, just try and stop the bleeding. But the most important thing is you need to ensure that they can no longer further harm themselves or you. That's an important thing to remember, that you are also at risk, and dial 911. Once the assessment has been conducted and then they have been discharged from hospital, I urge you, as a family unit, you need to go to counselling and work together on this. It is not an individual problem, it is a family problem, and you need to be there for your child or teenager to help them work through this, to help them feel that they can comfortably come with you and tell you, I've started cutting again, I'm fearful, I'm going to do something. And together you can seek help and work on strategies on how to help them. So yes, it's a very scary topic. And I think what we need to do is start working together and listening to our kids and helping them. And the words are listen to, validate, help, understand, and please show love. In my next YouTube video and blog post, I will be discussing dissociative identity disorder, formerly known as multiple personality disorder in children and teenagers, and you'd be very surprised to know that 80% of multiple personality is diagnosed in kids before the age of 18. Anyway, please join me then. Thank you.